Hi, everyone. I don't know who we have with us yet. I'm going to try to see. Make sure I see it. Yeah. So if you're joining us today, this is our very first Get Ready for Baby Q&A. And this session, we have some wonderful experts here who are going to be able to answer questions about baby care, as well as development and preparing those big siblings. So I have several of our wonderful panelists already here, and it looks like our attendees are joining us, even though I can't see that. So anyway, Summer, would you like to introduce yourself to the group, please?
You bet. Hi, I am Summer Hiett. I am a nurse with a program called Nurse Family Partnership that my group is at UCCS. There is also another group of Nurse Family Partnership nurses at El Paso County Health Department. And we are an organization of home visiting nurses, and we provide first-time mothers with specialty nursing, specialty trained nurses for nursing care throughout the first 1,000 days. And so that covers from pregnancy until the child's second birthday. And we visit in the home with low-income first-time mothers and work with them on a range of developmental, educational, nutrition, everything that spans from pregnancy, information and health and development, all the way through that pediatric life at the age of 2 and through birth and everything else. So we just kind of walk along with those moms in that journey and help them become the best mom that they can be. We can take referrals at any point from self-referred or from a number of organizations. A nurse can refer you, an organization can refer you. So you can get on our website as well if you're interested and learn more. And I know I have given Sarah Ellen our referral sheet too, so that will go out to participants if you're interested or know somebody who might need our services. So hope that's of interest. It's a great program.
It certainly is. And also you help lead our prenatal series through Pikes Peak Library District, correct? Do you want to talk about that just for a minute, Summer?
Yeah. So starting October 6th will be our next series. It's a 6-class series that happens on Wednesday afternoons. And it is kind of a nutshell of information for prenatal or very early, if you have had your baby and you're within the first, 3 to 4 months of life, that I think all of the information is still very pertinent and important, and you'll find very interesting. We cover things from birth, labor and delivery, breastfeeding, early literacy, sleep and crying, and just talking about, we can answer questions and tailor it to those who attend as well. And so infancy feeding is also part of that. And it's been a great opportunity to just kind of start a conversation about things that you might want to think about in, pregnancy and with a newborn. What's that going to look like? And so it's been very fun to do that. And we plan to go into next year with a library, perhaps moving from Zoom to in-person or a combination class as well. So right now we're on Zoom. So it's been really, really fun to have participants with that.
Yes, it's a nice ongoing program that keeps occurring. Is it 3 times a year now or 4 times a year, once a quarter?
Yeah, so we did 4 times this year, with this October season being our last session of the year. And then we'll start next year and we'll have 3 classes. I believe they'll be 7 weeks long then.
Okay, great. So I will, before I have Antoinette introduce herself, I would just want to say we do have several folks in attendance, and because this is a Q&A session, once our panelists are done introducing themselves, they will be ready to start answering questions. So please do start popping those questions into the Q&A. So, and Antoinette, would you like to introduce yourself, please?
Sure. Hello, everybody. I'm Antoinette Burns, and I am a pediatrician and a sleep medicine specialist. I've done general pediatrics for over 10 years, and I've done sleep medicine for the past, I think, going on 3 or 4 years now. And I'm currently working at Children's Hospital Colorado as a pediatric sleep provider. And I see all pediatric patients from birth until sometimes even beyond the age of 22, depending on the medical conditions that the patient might have. And we do everything from difficulty falling asleep, staying asleep, waking up too early, not seeming to get enough sleep. Also any sort of sleep breathing disorders. So you may have heard of obstructive sleep apnea or central sleep apnea. Sometimes children will have low oxygen during sleep. We also talk about nightmares and restlessness and restless legs. So all things sleep, and it's a lot of fun. I really enjoy it. And I get to spend a lot of time with my patients, which is fantastic. Different than general pediatrics, but I do miss that too. I miss seeing the babies growing up, but I do get to see a wide variety in my clinic now, which is really nice. I'm happy to be here and happy to answer any questions that you have about your children's sleep, your soon-to-be baby's sleep, or your own sleep as well.
Thank you so much, Antoinette. And Allie, would you please introduce yourself?
Absolutely. Okay, I'm Allison Sussman. I'm an occupational therapist at the Resource Exchange. The Resource Exchange is a wonderful company, and we work with a lot of children's age 0 to 3. We work specifically with kids that have any sort of a delay. We have occupational therapists, physical therapists, speech therapists, developmental interventionists, nutritionists. I'm probably missing some. Oh, social emotional providers, and case managers that we work with directly. And again, I might be missing some, so I apologize if I am. We can work with children ages 0 to 3, and we work directly with those children and the families. So we help empower families to be the therapist for their children if there is anything that they're concerned about. So it's a wonderful place. If you have any concerns about your child and want to get them evaluated, please reach out to the Resource Exchange.
Thank you, Allie. And can you explain for those who may not know what occupational therapy is and the kinds of questions that you can answer?
Yes. So occupational therapy is great. It can mean a lot of different things depending on who the population that you're working for is. So what I do is obviously working with children ages 0 to 3. So working with infants and babies. I work with children with a disability, any sort of anything that happened either at birth or after birth. So I work with children, for example, that were born really premature, or have something like Down syndrome or autism spectrum disorder, something like that. So we can work through the lifespan of a child with a delay. I would work and help families with feeding. I can help with fine motor delays. I can help with this population with rolling, crawling, walking, standing, with self-regulation, sensory processing, helping to learn how to dress themselves, tolerate bath times. pretty much anything that you want help with, an occupational therapist can help with. I know that's very broad, but if you have any questions regarding development, I'm here to help.
Thank you so much. So as you guys can see, we have an excellent array of panelists here. And I see one question has popped up in the Q&A. Before I read that, I am going to start a poll. And we just want to have an idea of who is in attendance today and what ages kiddos you have or if you're expecting. So please answer all of the categories that apply to your family and situation. And I'll just give it a minute or so. We have almost everyone who's answered. All right, so most everyone has answered. And basically, our demographics today is we have several folks who are pregnant and then a couple who have some toddlers, so a 1 and 2 year old. So I'll stop sharing that now and we'll go to our first question. Did I share that? Stop sharing. I'm going to close that. All right. So our first question is, my son is 14 months old, and I'm wondering what signs will he show to drop down to 1 nap?
I'm guessing that's for me, but I appreciate everyone else's input too. So probably the biggest thing to realize is that all children are going to be different. And so what another parent might say was what they noticed for their own child may not necessarily apply for yours. So just kind of recognizing that we all have different sleep needs and a little bit different sleep patterns as well. And what your 14-month-old does will not always apply to your newborn as well. So in general, though, when we're looking at a 14-month-old and looking for signs about maybe not needing that second nap during the day, the biggest thing I would say to look for are behavior changes. And so most of us can recognize when a child is tired or has not had enough sleep. Children tend to be more hyperactive as opposed to that true sleepiness that we feel as adults. And so if you're noticing maybe some more difficulty with behaviors or an improvement in behaviors, I guess would probably be a better way to look at it, because you're trying to find out when he may need less sleep, is to kind of pay attention to, okay, you know, he didn't sleep as long for this particular nap, but he's acting okay during the day. And really letting your child kind of help guide you as far as what they might need for their daytime napping. I know that's not very specific, and I apologize, but you know, it is something that can really change depending on the child. Some of the biggest parts of sleep scheduling, though, is to make sure that you set everything up the same way every time, so that you create an environment that will encourage your child to sleep and help to give them those cues, external cues from the environment that help them to know that it is time to sleep. So hopefully that helped a little bit.
And I would say with Antoinette, maybe also, like you said, not having that expectation of what happens with another child for you, that the range of those things changing, I know can be very, very great. It could be 1-year-olds could change to a 1 nap. It could be a 2.5-year-old could change, right? Like, so that there's not any, you know, it is really child specific, that, you know, what your situation might look like, not time or age range necessarily.
And again, folks, please feel free to add more questions into the chat, into the Q&A. All right, well, I have a question. my baby is 9 months old and was sleeping really well through the night and started waking up more frequently after being sick. How long does it kind of take to regulate back after a disruption like that?
So again, that can definitely happen. We do commonly see changes in sleep patterns after an illness. And a lot of that just has to do with during that time when a child is sick, they have additional needs. And you're probably spending a little bit more time with them, maybe interacting with them in a way that you weren't before. And children learn to enjoy that very much. They want that extra time with their parents, and they start to realize, they're incredibly smart, they start to realize that, oh, if I do this, then I get this as my reward. And so having that time with you is definitely a reward. And prior to, you said 9 months. So prior to 9 months, I would say, always respond. 6 months is really my cutoff. Always respond if your child expresses a need for anything during sleep. That's really important prior to 6 months. Once you're at 6 months, then you can start to work on maybe withdrawing the amount of interaction that you have with your child. Children develop what we call sleep associations. We all tend to have some, where we may see our favorite blanket, or just the sound of maybe if you turn on white noise at night, that starts to, in your brain, you associate that with sleep. And so kids can do that with their parents as well, and that attention that they're getting with their parent. And while, again, prior to 6 months, it's important to always be there, beyond that, we want to help them to learn that they can fall asleep on their own. But it's a skill, just like any other developmental skill, that they often have to practice and develop. And it's not going to come necessarily naturally. So I would say that if your child is now completely better, healthy, and you know that they don't necessarily need that interaction from you in the middle of the night for some of their basic needs, then I would say that you could start to see what happens if you slowly withdraw. Maybe take just a little bit longer to respond, and see if in that interim time they realize, oh, okay, maybe they're not coming as quickly, but I'm okay and I can fall back asleep on my own. Or when you respond, maybe come into the room, and if you typically would pick them up out of their crib, instead, maybe just calmly say, I'm here, it's okay, it's time to sleep. Maybe it would involve putting a hand on their head or on their back and kind of gently soothing them that way. Again, all kids are going to respond a little bit differently, but the important part is to remember that you are trying to help them learn a skill. They need to know that you're there when they want them or need your interaction, but also that they have that ability to help themselves to return back to sleep as well.
And there, for a follow-up to that, if the baby is not drinking a lot and they're bottle fed, so not drinking as much as one would, maybe, I don't even know what would be the normal, like how much should be in a bottle at this point with this stage. But if they stopped drinking as much as they were before because they were ill and are only taking a couple ounces at a time, and so the parent is concerned that maybe they're not getting enough, and so that's why they're waking up at night. And if you have anything to say to that, and I know Summer, you've got some experience with the feeding too, right? So
yeah, so I can start, and I would say that the most important thing, of course, is to make sure that your child is well. So as long as they're continuing to make wet diapers during the day, even though they may be dropping down on their pure liquid intake, if they're increasing some of the solid foods that they are getting during the day, remember that solid foods will also provide some fluid for them. And so it may not be that you want to keep a very close eye on the exact amount that they're taking in, but it's more kind of looking at that overall picture. How much urine are they putting out? Do their lips look dry? Are there any concerns that you have? And if that's the case, definitely you want to see your pediatrician right away. But if it's just that they're maybe not taking as much as they used to, you want to be careful that you're not encouraging of behavior that, again, they recognize, oh, if I cry, mom will come and bring me a bottle. You know, they don't necessarily put two and two together that, oh, that she's worried I'm dehydrated, that's why I'm going to do this and she'll respond. But they just know that, oh, if I do this, then she'll come and see me. And so I would try, if possible, now that she's well or he's well, to not do those nighttime feedings if you possibly can. That would be probably how I would start to respond to that one. Summer, you can fill in.
Yeah, I think that sometimes as they get busier and more aware at 9 months, right? Like maybe just like toddlers that they're so busy that making sure that that evening meal is big enough, right? And that they get that bottle at that point in time so that they're full and really get, you know, focused on food at that point, so that when they do go down, they're not hungrier than they would have been because they didn't really, you know, eat well because they were busy and distracted, you know, and now they're waking more frequently because they really are hungry through the night. But like, you know, yeah, trying to make sure that they have the good amount of time through the day to eat appropriately, so that at night you're not they're not getting into that habit and the call and response, like Antoinette is saying, like, oh, now they're used to that bottle at night and they're gonna, you know, continue to do that because then you come and the bottle comes and it's a great party. So I think maybe just thinking of those, being aware of that particular, you know, evening feeding time is important.
Well, thank you all. It looks like we have another question in the Q&A. My son will be 20 months when our second child will be born. How should I prepare him for his sibling? How should I expect him to respond to this new baby, again at 20 months old?
I can start if you'd like this time. That I think one of the things that is really great to do before birth is to practice and use words surrounding the baby, like, you know, teaching that the baby is inside mommy's tummy and that, you know, this is the baby is in here and this is baby's name. And we're gentle with mommy's tummy because we're going to be gentle with the baby. And then introducing like a doll, a baby doll that also can be rocked and cuddled and, you know, use gentle touches on. To begin to introduce that this is like our baby that's going to come and be near, and that can begin the conversation. And I know, Allie, I think you deal with that sometimes as well with introducing new babies. I can pass it to you to see what you would add.
Yeah, exactly. I tell my families to do those strategies all the time. So using that baby doll and calling it by a name, giving it a name and saying, oh, this is like baby sister or like new baby brother. And really being specific, oh, we're going to feed the baby, and really just giving the 20 months is old enough to give that child, your older child, a responsibility. Say, oh, okay, I want you to go get the new baby sister. Can you go get baby sister her diaper? We're going to change her. Can you go get her diaper? And really incorporate the older sibling into those routines. And we can practice that with the baby doll too before. So really trying to include the older sibling prior to birth and then after birth as well. I know that you had the question of how should we anticipate the child responding? That is a very incredibly challenging question to answer. Each child is so different that we have some children that are just love squish the child, the new baby sister or brother, and some that are just really back off, standoffish with that. So I can't answer that question specifically. Knowing the child's personality, you might have a better idea of what you think, how you think that they'll respond. But either way, I think that it'll be a really great interaction with the new baby. Another thing that I always try to remind parents is to have some one-on-one time with the older sibling too. It can be challenging right away when you have a new baby, but whatever that time might be, whether it's while the new baby is sleeping and you guys just do a little puzzle together. It can be mommy and Jordan time, you know, and just really making it special and really including them in that special time, and having them understand that this is special between you two. And then, oh, you're going to be the big brother. Can you go get the diaper, or can you help mommy make the milk now, or whatever that is, helps involve that child.
And I would just add, I love all of those suggestions. I think they're so important. The other part to remember is that you can sometimes see regression in an older child's development when there is a baby that comes in, because they see that, oh, the baby's getting attention for acting like a baby. And then sometimes you can see a regression in those skills that they had already mastered. And so I think something to help with that is to really, really praise your older child for the things that they do well. Catch them being good all the time. Everything that you like that they're doing, try never to keep that thought inside, and to always praise them. And just like Allie was saying, kind of show that you are a role model, and you're going to teach your baby sister or brother to be like this, as good as you are. And I think that can really be helpful as well, to make them also feel like they're getting attention from you and doing something that you approve of.
And I think like the question Allie brought up about how will your child respond, you will see more of your own child, like the older child's temperament, come out in that situation of like, am I going to be a little standoffish, or am I going to be all in and, nose to the baby 100% of the time? What are you doing? I want to see, I want to do. And so understanding that, and respecting a little bit about how your older child behaves and reacts to that introduction into life and into the routines, and just inviting, those things. Like I, think that, again, what Antoinette said about catching them being good in all of those respects, whether it's, oh, you're so observant, even if they are not wanting to be hands-on yet, or they're not wanting to really kind of get into the groove, it doesn't necessarily mean they don't like the baby or they don't like that interaction. They really may just be absorbing and observing first, and that can be part of learning that older child's temperament. What's their personality like? Do they need some time to absorb, to see, to, really kind of get what's going on? Or are they very much, in it to win it with the other baby, want to be right there side by side? And praising those things too, that if that's the temperament of your older child, that there can be strengths in either situation of how that, how your older one might react. And I think she added into the chat, like, if they are older, I think maybe the question might be like, does it change at all for, using the baby doll? I would just say no, like you still want to do all of those things with an older child, even, if they're going into, 4 and 5, same thing, that they're going to learn and just more developmentally sophisticated, with like a 5 or a 4-year-old will really understand, like, the baby's bottle goes here in the diaper, and we change and we wipe and we do all of those things. And they can even become a bigger helper. You know, you can involve them in that helping attitude that they oftentimes really like to do. But I was going to say, Antoinette, you had mentioned a time before about having separate bedtime routines with your children separately. And I would love for you to add that in, because I thought that was such good information previously.
Oh, sure. Yeah. So I think that having a bedtime routine, that, again, it's important that the routine is not very intense, because as you have more children or more responsibilities, you want it to be something that you can maintain and sustain over time. And so having a specific bedtime routine for each child, I think, is really important. You can sometimes maybe start together if you maybe want your older child to read a book to the new baby as part of that routine. Reading to bed is a great routine. I love that one. And then maybe having a separate time with that older child, very specific. And like Allie and Summer were both saying, making sure that they know this is your own time with mommy or daddy, and and read that book or kind of do what it is that you want to do with them. One caution is sometimes, if a child feels as though during the day, maybe they didn't get a lot of attention from you, and then they have that opportunity with you one-on-one, sometimes you can see behaviors that you may not want to see during that attempt to go to bed. And so if that's the case, then I would say trying to set a specific time also during the day earlier, where they have that opportunity to maybe vent, get some of those feelings, those emotions out to you before you settle down for bed, because sometimes that can be an opportunity where those will emerge and make it difficult for bedtime. But yes, I do like having, if you possibly can, separate bedtime routines that, again, are short, but something that you can do every night with each child.
I'd like to add in too that the library has a lot of wonderful books about pregnancy, about new babies, about big siblings with new babies. There's big brother books, there's big sister books, there's this cute book about a dog who has a baby welcomed into the family. I think the dog's name is Bobo, super cute. So I will be sending out a list of resources and a link to some catalog searches to our attendees after the program within the next couple of days, with some links to some of those. But if you go into any of your local library branches, we are happy to help you find things that we just have on hand. There are both board books, which are great for those toddlers who are going to become big siblings, but then there's also picture books. So either way, we've got a full gamut. We've got books about siblings who are really excited, and siblings who are having a hard time figuring out how to share or what they think about the new baby. So if, after baby has come and you're like, we're experiencing this kind of behavior or attitude, can we, and we can share some books with you in that area as well. So let's see. There's also, I'm just going to point this out. This is on the list of ones that I was going to share. But there's this book called Lola Loves Leo, or Lola Reads to Leo. And it's about a big sister who reads to her brother throughout the day. And, maybe she's reading, but, maybe she's just telling a story and sharing a book. And basically this family, they involved the big sibling throughout the day to interact with her baby brother by reading and sharing stories. So I think that that's a great way to, think about and introduce, like, these are different things that you'll be able to do with the baby throughout the day. And not only read, but you can sing, and we can talk, and we can play games together. So please do put in some more questions into our Q&A. While we're waiting for someone else to add in a question, maybe the three of you could share some of the questions that you wish parents would ask about maybe these topics. So
Sarah Ellen, I just want to point out that there is a question in the chat.
Oh, there is. I missed that one.
From
okay.
Megan, that maybe we can do that one first.
Yes, I'll go ahead and read that. So we have a question. I understand the importance of giving children lots of hands-on experiences before the age of 3. With morning sickness, the older child hasn't had a lot of experiences and out of the house adventures. What are some tips or strategies to help the other child and not completely interrupt or delay the older child's own learning experiences? Or is the baby going to help build social and emotional skills?
I would venture to say that yes to the bottom question, right? Like the social and emotional interaction will definitely be built into the life of the growing family. Learning, more about baby and another person. You're learning a lot of empathy, and you're learning to, interact with mom and dad and baby in a little bit different way. And I would also say that, hands-on experiences are super great, but they don't always have to be outside the house. They can be at home. They can be with, at the table with Play-Doh. They can be at the back patio with, same thing, just textile types of, play, blocks, any of those kinds of toys, and reading. And a lot of what Sarah Ellen had said about those books that give them a framework for seeing that experience that they recognize, like, oh, that's a new baby. Oh, that person has a new baby too. That really can be so powerful to read those over and over again, to really understand and solidify that learning as they're seeing, oh, mom's pregnant. Oh, that lady in the book is pregnant. That very much connects, and they learn quite a lot, learning experiences through those books the same way. So I'd say that's a start for that question. I'll let everybody else jump in.
Yeah, I think that's a great point. I think that reading books that talk about friendship is really good too, because I heard you say that, or I read you saying about, not getting your child out as much as maybe you would like because of your morning sickness, and that's so challenging. But yeah, so reading books, doing exploration things via telehealth. So any sort of cousins, anything on the computer, technology is great. But I know it's not exactly the same thing as what you would like, but that's okay. It's what we can do right now in the circumstances, and that's fine. Life is challenging at the moment, and being pregnant poses another challenge to it. So reading books, doing other things around the house that is like turn taking. I am not sure how old your child is. Yours might be the one that's about 3. Yeah, so working on like turn taking at this point in time would be great, even if it's with you and her or you and him. And talking about, when you go on the playground, you can let your friend go first or something like that, is all wonderful ideas that you can do at home. And yeah, I think that those are great strategies. Oh, talking about the baby too. Yeah, I think that older siblings learn so much from a younger sibling. Oh, it's a beautiful interaction. And I think that you'll find that as well. It's a different type of interaction than interacting with peers, but it's wonderful. And they get to also see your interaction with the baby too, which they learned so much from. So I think that it'll be a really great learning experience for them.
I'd like to just add into that. I want to allay any concerns that anyone might have, but with library programs like our toddler time or our story time programs, those programs are always open to the targeted age as well as any siblings. So that will be something that you can think about, you know, when you're ready to start getting baby out of the house, but taking your older child to a story time program. You'll certainly be able to bring your baby along, taking your baby to a baby time program, bring your older child and have them bring a baby doll so that they can do the rhymes and everything with, as you're doing it with the baby sibling. So those will be some nice things that you can do when you're feeling better and when you're able to start getting out of the house again. So going back to, since we do have a pause and questions, are there any top questions that you wish parents would ask about any of these stages or topics?
I wish that parents would ask anything they're ever wondering about. I think sometimes parents get nervous that, oh, I don't want to bother you, or you don't have time to answer my question, or I should know this already. And so I think that just kind of really letting you know that we want to answer your questions. And, you know, that's part of why we do what we do and why we love what we do, is because we want to be able to help make things easier for you, help you learn how to do things to the best of your ability. So I guess that would be my opening, would just be, you know, please, any question at any time, no matter how you might be feeling about it, you know, please ask.
That's a really great point. Thank you, Antoinette.
Yeah, I think sometimes our expectations are not always aligned with the age of the child as a parent, having sort of like an expectation that they might be beyond a certain, you know, so I'll give an example to kind of hone it in, is that, and this is definitely in Antoinette's wheelhouse, is that the idea of sleeping through the night, what that expectation brings with it, that phrase, can be very troublesome to parents in many ways. Like the idea of, yes, I have such little sleep, but I'm so tired. that one alone, but also that you hear a lot of other people say, well, my baby slept through the night at 2 months, and my baby slept through the night at, 2 weeks, and things like that. But from a medical standpoint, and this goes to asking those questions for sure, that please feel free to always, bring those questions to your providers and experts, that, that phrase, really, a baby sleeping through the night is about 5 hours at a time. That's it. So if a baby sleeps 5 hours, that, at the point that they do that, then we would call that sleeping through the night. But there are many developmental things that need to take place and need that time from 0 to 4 months really to happen with that baby's brain and development, that we really, as I would say, we don't want them sleeping through the night, because that's not healthy. So, there's, again, that example in and of itself gives lots of different pieces and information to say, like, that one phrase can be so troublesome for everybody, that you might feel like, I'm a failure because they're not sleeping through the night and they're getting up and I'm so tired. And is this normal? And is this okay? And, do I have a bad baby? And like, no. your baby's perfect. Your baby is doing what they're supposed to. And developmentally, it's really important to wake frequently through the night. And so I think that's, I don't know if anybody wants us to elaborate on any of that information. Absolutely can. I know Antoinette can as well. As far as the science of babies' brains at that point, it's really important to understand because it'll help you understand why they're waking so frequently.
Yeah, I can certainly talk to that if people are interested in that. I'm always interested in it. But so exactly what Summer was saying is kind of that expectation of sleep and sleeping through the night. And she's exactly right. Babies don't have the skill, the ability to do that until they're closer to 4 or 6 months of age. And a lot of that has to do with the way that the brain is developing. So I think most of us know we need melatonin in order to have a circadian rhythm that helps us to fall asleep, which is why some people take melatonin to try to help them fall asleep, which is a whole nother topic we'll talk about later. But and the brain doesn't, the pineal gland, which is the part of the brain that actually makes melatonin, is not fully developed until closer to 4 months of age. And so babies don't have that rhythm, that separation of day and night. And so that's why when they're first born, their pattern is extremely short for their sleeping. So they may be awake for an hour and then they'll sleep for 2 hours, and then they'll be awake for an hour and asleep for 2 hours. And they'll just repeat that throughout a 24-hour cycle. And that is normal, that's expected. A part of that has to do with the brain development. The other part has to do with how much they're growing. They need that constant source of food so that they can continue to grow, so their brains can develop during sleep, and they can learn things during the day, of course, as well. And so as they get older, those sleep times become longer, and they shift towards the evening, and the wake times become longer during the day. And that's kind of the natural progression. But it's not until they're around that 6 months of age before we would expect them to have a chunk of time during the evening that is more than 4 hours. And a lot of times what I've told parents is that we get worried, we get concerned if they are sleeping for more than 3 hours at a time before the age of 2 months. Certainly if they're a month and their weight is great and they're eating fine, developing beautifully, they may have that pattern, and that would be okay. But prior to that time, we really want to make sure that they are up frequently feeding. I'll leave it at that for now, but I can certainly talk more about that if, the other thing just to remember is that even by 12 months of age, not all children are sleeping through the night. And so that is normal. We don't expect 100% of children, even at 12 months of age, to have that ability to sleep for more than 5 to 6 hours at a time. So just to kind of help normalize that for everybody.
That is so good to know. We did have a question in the Q&A specifically asking Antoinette, but Summer and Allie, please chime in if you know this. They've asked, have you heard of I believe it's Taking Care of Babies course? And if so, what are your thoughts on it?
I'm not sure that I know what that is. Is it an online program or a local program? I'm not sure what that is.
I've heard of it. I actually have a few patients that have gone through it and a few friends that have gone through it. And it's an online course, and apparently you can have like phone calls with her, is my understanding. I might be incorrect on that exactly. I haven't done a ton of research on it myself, but it's like a sleep course, and they do it for different months. Are you looking at her website now? Yeah. It seems very interesting to me. I've gone through a few different courses, or I've heard from a few different sleep specialists, and it seems decently in line with some that I've heard before. So I guess I wouldn't be the one to recommend something personally, but it seems decent to me. I don't know what you guys think though.
So I did just pull up the website to see what it looked like. And it's a beautiful website, first of all. And my first reaction is that I always worry about things that you have to pay for, that you could get for free from other areas, other resources. And a lot of times the sleep programs that are online are run by people that may not have formal training in sleep. And so I always worry that some of the information is anecdotal and may apply to one baby, but not to another. And then sometimes I just get nervous that, if you're trying to follow a script that someone else says is the right way to do things, that you get frustrated if your child doesn't respond in that exact same way. But I will, I don't know what's in it as far as the content, the science behind it. It might be fantastic. And if you can afford it and it's important to you to spend money on something like that, then certainly I wouldn't discourage it. However, I would encourage maybe looking for other resources that you don't have to pay for online. But just my opinion.
I think a lot of that information can be got from your pediatrician with your child, and knowing, learning about your child personally makes a big difference. Like Antoinette said, it's, if, for instance, you did all these things that she's saying that you felt, I would hate for parents to feel set up for failure, where, this works for everybody else. And again, that's sort of some of taking to heart the idea of expectation for parents, that just because it worked for someone else does not mean that it will work for you or your child or your family, right? Your situation, how your family dynamics and your household work can be very different from another family, and very different personalities in the mix. And that those things really need some thoughtful and tailored, right? To what works in your house with your kiddos' personalities. That I think we have to be careful in the social media day and age about comparing, comparison. Just, ask the experts, trust your pediatricians, and trust your nurses and other specialists, the OTs and, speech therapists and things like that you may be connected with, but that they will be able to take your instance into account, right? And really ask your personal questions. And I think that that's probably going to get you the best result ultimately.
I think that's such a wonderful thing to be thinking about is, motherhood and parenthood right now. As Summer was saying, there are so many examples of this is the way to do it, or this is what worked for me, now that we can see more personally into people's lives as they're sharing on social media. And, when you're with your own family, you have to find what works for you. And I'd like to just put a plug in here that if you are questioning, certain areas, or you just want to know more information, talk to your pediatrician, talk to, Nurse Family Partnership if you get on board with them, or Peak Vista also has a visitor program for 0 to age 3. Also come and talk to your librarian. We have a lot of resources. We have several family place libraries in our district where we have specific parenting collections. And these are print resources, DVDs, music CDs, as well as we have a special parenting collection in our Overdrive ebook resources. And those can be really fantastic when you're up at night with the baby, being able to read or listen to a book on your phone while you're taking care of a baby in the middle of the night can be really helpful so that you can stay safe while you're up with them. So I am talking here and wondering if there's any other questions or any other general information that our wonderful panelists can give. Oh, looks like we have a question here. Let me ask that. All right, so we have a question. I plan to have the baby sleep in a bassinet in my room and transition to a crib after 6 months. Do you recommend the siblings sleep in separate rooms after the baby isn't sleeping in my own room? If the baby is in a separate room, but still next to the toddler, will the toddler be able to sleep through the baby crying? Or what do you recommend on how to help the toddler sleep?
That is such a great question. Yes, I love it. So I love your plan. So yes, safe sleep, that's extremely important. And so keeping the baby the first 6 months of age, we do recommend that they sleep in your room, but in their own sleep environment. So making sure that they are in a safe crib or bassinet, something that has been certified to be safe for children, and keeping that next to the bed so that you can breastfeed if you are choosing to do that, which we hope you do, but understand if maybe you can't. And then after 6 months, we do encourage you to transition them, if possible, to their own room. If you have the resources for each of your children to have their own room, I think that is ideal. However, if you don't have those resources, it is okay, and we can figure ways to have children share rooms effectively and healthfully. Probably one of the biggest things that I encourage families to do is to get a white noise machine. So either an official white noise machine that you can purchase if you just Google white noise machine, or even a fan that is a louder fan. So not one of the whisper quiet fans, but something that actually makes a really good background noise. And place that between where the baby is and where your other child is. So if they're in the same room, you would want to place it in between the two of them. And I like to think of it as a force field. This is a sound force field that's kind of blocking one side from the other. For young toddlers, they kind of sometimes really get into that, like it's a protective field for them. But then it can really serve to block some of those noises that can disrupt the older child from the younger child waking up frequently. Let me just see what else was in that question. Sleep in separate rooms, yes. And the other part about that's important is that if the older child sees the baby sleeping in your room, sometimes that can lead to, again, either a regression in development where they want to now come back and sleep in your bed with you, or if they never did before, all of a sudden you find that that's something that they're looking for. And so really making sure that, again, you praise the older child for sleeping in their own room, setting the example, the baby's going to have their own room, and kind of working on that from the beginning to really emphasize that importance of sleeping in your own room. I know we're almost out of time. I don't want to keep.
Thank you so much. I'm going to take a look and see if there's any information in the chat happening right now. I don't see anything there yet. This has been.
If I can add one thing. One of the points that you made, Sarah Ellen, that I really liked and wanted to just encourage families that if you happen to be in a medical system where you have the electronic communication that you can have with your provider, I would really encourage everyone to set that up, because just like Sarah Ellen was saying, when you are up in the middle of the night, that's when you're going to have these questions and they're going to pop into your head. And so I would encourage you to be able to just shoot off a quick message to your provider's office, whatever it is that you're thinking. And that way you can hopefully get an answer during the day when you may have kind of moved beyond it or don't have time to call the office. So really use the technology that's available to help with answering your questions.
That is a great tip. And before we close out, I just want to remind folks that if you haven't been into your local library branch this month, September all September, we are celebrating Bumps and Babies with our Bumps and Babies Resource Fair. And we have board books available to give out to anyone who comes in and asks and says, I'm expecting, I have a baby, give me my free stuff. And so please come in and get that book. Also, we have a lot of other great resources. We have some videos on tummy time that will be premiering all month long on our PPLD TV YouTube channel. And in 2 weeks, we have another session like this one. It's our Busy Babies, What Can You Do program. And it's going to be a Zoom meeting where attendees will actually be able to be live and able to ask questions live and see and meet some of the folks who offer classes and programs and activity ideas in our community. So if you haven't registered for that yet, please do so. Well, I just want to give a big round of applause and huge thank you to Summer and Allie and Antoinette. You have all been just amazing tonight. Thank you so much for all of your wonderful, wonderful advice. We're getting some great comments, just that this was a huge help for people. So thank you for participating in this program. And please do, again, if you guys are interested in learning more from these wonderful resources, Summer and Antoinette both participate in our prenatal series, and that's going to be happening again this October. And Allie is a regular on our Parenting Little Ones series, which will also be starting again in October. So please check out more of the free PPLD programs. You all have a good night. Thanks so much. Bye, everybody.